So guys, moving on to the development of the arteries in the arterial system. Once again, we need to know that what are the raw material we have using which we can discuss the development of the arterial system. So what we have in the beginning is that during the development of all those mesoderm into three part, paraaxial, intermediate, lateral plate. So just below the paraaxial mesoderm, you will also see the development of two dorsal aorta. Now we have two dorsal aorta with us. The body is having a two aorta developing called as dorsal aorta, one right dorsal aorta, left dorsal aorta. And this is dorsally placed. And we know that with the craniocaudal folding, the heart actually came relatively in front. So imagine if the developing heart tube is in front and we have two dorsal aorta behind. What is the point of having the dorsal aorta if it is not connected to the heart? So the heart will be connected to these dorsal aorta. The developing heart tube will connect it to the dorsal aorta by the pharyngeal arch arteries. How many pharyngeal arches we have in the beginning? That is 6 pharyngeal arch. And every pharyngeal arch is having one artery inside. So then pharyngeal arch artery is actually from this heart tube, it goes backwards and laterally and goes into what? The dorsal aorta. So in the arterial system development, in the development of the arterial system, what you will see that we have the two dorsal aorta. We got a right and the left dorsal aorta. Once again, I'm using these dotted lines here. This is a right dorsal aorta here. And then we have this left dorsal aorta. That is right dorsal aorta and that is left dorsal aorta. I'm writing in short, that is right dorsal aorta, left dorsal aorta. And if you look at the cranial end of the heart tube, what was the cranial end of the heart tube? That was truncus arteriosus. So let me start from there. If this is a truncus arteriosus, if this here is a truncus arteriosus, we have this development of aortic sac, the cranial part of the truncus arteriosus. I'm writing in short only. This is truncus arteriosus and this is aortic sac. Just keep writing these full forms somewhere else separately, not in the diagram. So TA is truncus arteriosus, sinus venosus, primitive atrium, primitive ventricle, bulbus cordis. And then the cranial part of bulbus cordis was this truncus arteriosus. And this is aortic sac. As the name suggests, it is aortic sac. And this aortic sac will have two horns. We have the right horn of the aortic sac and there will be the left horn of the aortic sac. That is a right horn and that is a left horn of the aortic sac. And as we said, these horns of the aortic sac, or this is a part of the heart tube which will get connected to the dorsal aorta by 6 pharyngeal arch arteries. So this is the first arch artery here. Second arch artery, third arch artery, fourth, let's say fifth, and I'm drawing this one as a 6th arch artery. That is first arch artery, second, third, fourth, fifth and the 6th. Right, so this is what we have with us. This is a raw material using which we have to discuss the development of all major arteries here. So just take 20 seconds and just complete this diagram. Just draw all these dotted lines so that you are with me on the same page. So truncus arteriosus having this aortic sac dividing into the right and the left horn, and then from this left horn we have these 6 pharyngeal arch arteries which are running through the pharyngeal arch and going backwards and draining into the dorsal aorta, connected to the right and left dorsal aorta. Just like inferior vena cava development, once you find out the inferior vena cava, the rest of the tributaries becomes understandable. Same thing here. You need to find out the arch of aorta, that is a main artery, and rest everything is a branch from the arch of aorta itself. So guys, arch of aorta is derived from what structure? So arch of aorta is derived from number 1, that is the aortic sac. If I keep knowing, that is aortic sac. Number 2, that is the left horn of aortic sac. Number 3, left fourth arch artery. And number 4, left dorsal aorta. Just make sure you highlight that part, and in the meantime I'll write it for you as well on the side. So you're looking at the arch of aorta. Arch of aorta derived from, number 1, from the aortic sac. Number 2, from the left horn of aortic sac. Number 3, left fourth arch artery. And number 4, left dorsal aorta. This is the main thing. Once you find out the arch of aorta, rest is easy. So aortic sac, left horn of aortic sac, left fourth arch artery, and left dorsal aorta, the 4 components which together gives rise to the arch of aorta. Once you find the arch of aorta, I hope you wrote that as well. Once you find out this arch of aorta, guys, then we have 3 branches coming from arch of aorta. The 3 main branches, that is left subclavian, left common carotid, and obviously brachiocephalic artery. Well, this here is the left 7th cervical intersegmental artery. 7th cervical intersegmental artery. The dorsal aorta is giving off many segmental arteries, like we have 7th cervical intersegmental, then thoracic segmental, lumbar segmental artery. So out of those segmental artery, the 7th cervical intersegmental artery, it actually becomes what? Subclavian artery, and that is only toward the left side. Left 7th cervical intersegmental artery is the one which will give rise to the left subclavian artery. It will give rise to the left subclavian artery. We say left subclavian artery is a branch of the arch of aorta. It is, but technically speaking, if you see it from the developmental point of view, it is a branch coming from the dorsal aorta, from the left dorsal aorta directly. But that piece of dorsal aorta is utilized to form the arch of aorta. So that is why the left subclavian artery looks like coming from the arch of aorta itself. So 7th cervical intersegmental artery, it gives rise to the left subclavian. We do have 7th cervical intersegmental on the right side as well, but that is a completely different scenario there. So what you'll see here, one artery is 7th subclavian artery, left subclavian. The second major artery coming from arch of aorta is the common carotid. So we have the left common carotid artery. Now common carotid artery, guys, look at this. It comes from this third arch artery. If I highlight this part, this is a third arch artery and this cranial part of the dorsal aorta. This cranial part of dorsal aorta. If you remember that concept of vasculogenesis and angiogenesis, when you see the blood vessels in continuation, common carotid artery, it continues as internal carotid artery, isn't it? So this is giving rise to common carotid artery as well as internal carotid. Whereas the bud for external carotid artery will emerge from the third arch artery. This is the common carotid artery. This is internal carotid artery, the rest of it. And this is the bud coming out, that is the bud of external carotid artery. Let me just enlarge this thing for you. So we got a common carotid artery, we got the bud for external carotid, and this rest of it is the internal carotid artery. So if for the writing purpose, common carotid artery, what you'll say, where the common carotid artery is derived from? It is derived from which arch artery? Third arch artery. But not entirely. From the proximal part of third arch artery. Common carotid is by the proximal part of third arch artery. Internal carotid is by the distal part of third arch artery as well as this cranial part of dorsal aorta. Once again, it's better to write it down. We said common carotid artery, it is derived from what? It is derived from the proximal part of third arch artery. Proximal part of the third arch artery. See, I'm not writing right or left because we have the same component on the right side as well. So you have to say, because we're talking about the branch of the arch of aorta, so I should say left common carotid artery and left third arch artery. But because we have exact same component toward the right and left side, so just to, so that there won't be any confusion in that, I'm not using the word right and left here. Proximal part of third arch artery on both sides will give rise to common carotid. Whereas the internal carotid artery is the one which comes from where? It comes from the, first of all, from the distal part of third arch artery, and also by the cranial part of dorsal aorta. Also by the cranial part of dorsal aorta. That is the internal carotid artery, which is derived from the cranial part of the dorsal aorta along with distal part of third arch artery. So these are the two direct branches coming from the arch of aorta. One is the subclavian artery, and now you saw that common carotid artery, left common carotid artery. What is the third main artery from the arch of aorta, guys? That is the brachiocephalic. Now we know that brachiocephalic artery purpose is to go toward the right side and again divide into the common carotid and subclavian. So the brachiocephalic artery is just by this. And what is that? That is a right horn of aortic sac. That's it. Please write that. That brachiocephalic artery is by the right horn of aortic sac. Brachiocephalic artery will be derived from this right horn of aortic sac, the right horn of aortic sac. Right horn of aortic sac. And once you find out this right horn of aortic sac giving rise to brachiocephalic artery, the common carotid artery and subclavian artery are the branches coming from this brachiocephalic. Common carotid, no problem. It's just like on the left side. There we go. Same again. Third arch artery. And then cranial part of dorsal aorta. And this is the bud for external carotid. So it's all same. I just need to write common carotid artery here. It makes sense. The rest is internal carotid and external carotid. The main challenge here is the subclavian artery. Now subclavian artery on the left side, we can see on the left side it is coming from the left 7th cervical intersegmental artery only. But that is not possible on this side. Look at this, guys. If this is the right 7th cervical intersegmental artery, let me put that first. This is the right 7th cervical intersegmental artery. But this right 7th cervical intersegmental artery alone cannot form the subclavian artery. Subclavian artery on the left side, it comes from the brachiocephalic artery. And brachiocephalic artery is here. This is the brachiocephalic artery. So we need the connection of this brachiocephalic artery to this 7th cervical intersegmental. How is it done? Now on the left side, we have 4th arch artery forming arch of aorta. On the right side, there is no arch of aorta, but obviously we have the 4th arch artery here. So this time I can use this 4th arch artery, that is number 1, the 4th arch artery. I can use this dorsal aorta, that is this number 2, and then the 7th cervical intersegmental artery. So basically there are 3 components for the development of the right subclavian artery, the 3 components which I'm marking here. What is number 1? That is a right 4th arch artery. What is number 2? Right dorsal aorta. And what is number 3? That is right 7th cervical intersegmental artery. So all these 3 together will give rise to the right subclavian artery. This 1 plus 2 plus 3, they together will give rise to the right subclavian artery. If you would just repeat what is 1, 2 and 3 and make sure to write it also. 1 is the right 4th arch artery. Number 2 is what? That is the right dorsal aorta. And number 3 is the right 7th cervical intersegmental artery. Right 7th cervical intersegmental artery. So these are the 3 components of the right subclavian artery. It's so much different from the left side. Left side only 1 artery, and right side we have the 3 arteries together which is forming the subclavian. Okay. This is about the arch of aorta and the branches from arch of aorta. Now, guys, let us say here we have the developing lung buds or the respiratory buds. Remember the respiratory buds we talked about developing from the foregut. So let us say these are the lung buds or the respiratory buds, those endodermal buds. And these lung buds are invaded by They're invaded by this developing sixth arch artery. Look at that. The lung buds which are invaded by this developing sixth arch artery. So obviously what are we talking about? We're talking about the pulmonary artery here. That is pulmonary artery. So how does the pulmonary artery comes into the picture? Pulmonary artery is derived from what? Well, sixth arch, not the entire sixth arch, that is the proximal part of sixth arch artery. That is by the proximal part of the sixth arch artery. Fifth arch completely disappears. So there's nothing about the fifth arch to be discussed. So proximal part of sixth arch artery, this will give rise to the pulmonary artery. And if this is pulmonary artery, that also explains me about this. What is that, guys? What is this? This is nothing but the ductus arteriosus. Look at that. That is ductus arteriosus, connecting the pulmonary artery to the arch of aorta. That is ductus arteriosus. So what you will say, ductus arteriosus is derived from where? Let me write that as well. Ductus arteriosus is derived from the distal part of the left sixth arch artery. Distal part of the left sixth arch artery. The distal part of the left sixth arch artery. This is the one which will give rise to the ductus arteriosus. Ductus venosus was the one which was in the liver. Remember? Left umbilical vein shunting the blood toward the hepatocardiac channel. This is the ductus arteriosus, which is by the distal part of left sixth arch artery. So guys, this is about the development of all the major arteries coming from the arch of aorta and the two branches from the pulmonary trunk as well. That is the pulmonary arteries. If I may ask you to just go back into your notes in the pharyngeal arch column, guys. Can you just give yourself a minute and go back into the pharyngeal arch embryology we discussed, where we drew all those tables. In the first column, we write the arch and the nerve of the arch, the muscle and the cartilage, and the last column was about artery. So can you just go back there and just look at that page? Now, if you've reached there, if you're looking at that table, now look at what is the artery we wrote for the first arch, guys. The artery from the first arch, we wrote the maxillary artery. So maxillary artery actually is the remnant of this first arch artery. Look at this first arch artery here. We didn't draw anything in this. So the remnant of the first arch artery is maxillary artery. Although we know maxillary artery is a branch of external carotid, and external carotid is developing from third arch. They develop separately. Maxillary artery separately, external carotid separately. Later on, external carotid will join with the maxillary. So maxillary artery is a remnant of the first arch artery. What is the artery you wrote for the second arch? You wrote it the stapedial artery and hyoid artery. Again, that is a remnant of the second arch artery, forming the stapedial artery and the hyoid artery. What is the artery you wrote for the third arch? Now, this is the portion from where it makes more sense. Third arch artery, you wrote common carotid and internal carotid. Look at this, makes sense? Common carotid, and then continuation is forming what? Internal carotid. That is from third arch. Fourth arch artery, we wrote what? Arch of aorta. Look at this fourth arch is forming arch of aorta and also the right subclavian artery. So arch of aorta and the right subclavian. And sixth arch artery you've written is the pulmonary artery and the ductus arteriosus. This pulmonary artery and ductus arteriosus is the sixth arch artery. That's the reason we wrote those arteries there, because whatever arteries we have in those pharyngeal arches, ultimately they will give rise to these adult arteries, that is maxillary or stapedial or common carotid, arch of aorta or pulmonary artery. So well, this is about the development of the normal arterial system. There is more to it, guys. I mean, there's recently a question, like 2 years back, there was a question asked in the AIIMS exam about the formation of the abnormal subclavian artery, abnormal right subclavian artery. So let me tell you about the abnormal right subclavian artery. But before that, to understand that better, you should know that the right dorsal aorta and the left dorsal aorta, we have the right and left dorsal aorta separate, but in the lower part of the body, the right and left dorsal aorta, they fuse also and form a fused dorsal aorta. They form a common aorta then, when they fuse in the lower part. What I'm saying, let me put it diagrammatically. This is the right dorsal aorta. And this here is a left dorsal aorta. And you can see they're fusing in the lower part. This is the right dorsal and that is left dorsal aorta. What we already know from the development of arch of aorta. So I mean, just let me draw this arch of aorta here. This is the usual arch of aorta. And here is the brachiocephalic trunk. Let me just put these two first. Arch of aorta and that is brachiocephalic trunk. We already discussed that. Now let me put this demarcating line to the arch of aorta. Guys, if till this point it is arch of aorta, below the arch of aorta obviously that will be the descending aorta. So this picture gives me an idea about the descending aorta, thoracic as well as abdominal. This descending aorta will be derived from what? The descending aorta will be derived from the, number one is this and number two is this. That is the caudal part. That is a caudal part of the left dorsal aorta. Caudal part of left dorsal aorta. And also by the fused dorsal aortae of both sides. Fused dorsal aorta, right and left aorta fusing. They together will give rise to the descending aorta. So after arch of aorta, this is the descending aorta which is derived from the caudal part of left dorsal aorta and the fused dorsal aorta. I'm moving toward my question. Now, from the brachiocephalic artery, we know that subclavian artery will also come. And if I just point, don't draw it entirely, subclavian artery was by what? That was by this fourth arch artery. That was by the fourth arch artery, the dorsal aorta, and then by this seventh cervical intersegmental artery. Right? This was the normal right subclavian artery. But the question asked was about the abnormal right subclavian artery. What is abnormal right subclavian artery? If there is obliteration of this fourth arch artery, imagine this fourth arch artery obliterates on the right side. If the fourth arch artery will obliterate on the right side, that means the subclavian artery now cannot come from brachiocephalic. So where the subclavian artery will come from? Well, the only option left is this. The subclavian artery will come from this caudal part of the right dorsal aorta and the seventh cervical intersegmental artery. Make sense? This is the persistence of caudal part of right dorsal aorta. And this though obviously we know that is right seventh cervical intersegmental artery. These two together will give rise to the abnormal. These two together will give rise to the abnormal right subclavian artery. That will give rise to the abnormal right subclavian artery. So these are the two components the question is asked. It's the persistence of the caudal part of right dorsal aorta which gives rise to the abnormal right subclavian artery. And the abnormality here, the anomaly here, the problem here is it is a right subclavian artery we are talking about, imagine, and it is now coming from where? From the aorta. Aorta is on what side? Aorta is on the left side. And artery we are talking about is right subclavian artery. So if right subclavian artery comes all the way from the aorta, that is from the left side to right side it will come. So it will also cross the esophagus and can compress the esophagus and causing dysphagia lusoria also. If let's say this is esophagus, that is esophagus. So esophagus is being crossed by this artery here. It can cause dyspnea as well, but it is more closely related to esophagus, so causing the dysphagia lusoria. That can cause a dysphagia lusoria. This is about the abnormal right subclavian artery, which is formed by the right seventh cervical intersegmental and also by the caudal part of right dorsal aorta if it persists. Both these will form the abnormal subclavian artery, right subclavian artery, and that can cause dysphagia lusoria. And I want you to take your attention to one very important thing here, guys. Please understand that I have said that there is an obliteration of that fourth arch artery. This is also very important to note. That is obliteration of the fourth arch artery there, and then the persistence of the dorsal aorta. Just for 1 second, imagine we have a persistence of the fourth, dorsal aorta on this side, that is there, but there is a persistence of fourth arch artery also. If both will persist, in that case we have both fourth arch arteries and we have both caudal part of dorsal aorta, and that will give rise to the double aortic arch. That will give rise to a double aortic arch. You can note that also, that persistence of both side fourth arch artery and persistence of caudal part of both dorsal aorta will give rise to the double aortic arch. I'll repeat again this for you if you're writing. Persistence of both fourth arch artery, right and left both, persistence of both fourth arch artery and caudal part of both dorsal aorta. And caudal part of both dorsal aorta gives rise to the double aortic arch, or double arch of aorta, you can say. It is forming a vascular ring around the trachea and the esophagus, and compress the trachea and esophagus as well in between. That is also called as a vascular ring. Double aortic arch or vascular ring around the ascending aorta and pulmonary trunk. Ascending aorta and trachea, vascular ring around the trachea and esophagus. So this is about the arterial system development. I hope you understood the part of how the main arteries are coming into the picture, and especially this question, which was an image-based question in AIIMS about the development of abnormal right subclavian artery. I just once again warn you on this question. The question is not complete, the answer is not complete if you just say the persistence of the caudal part of right dorsal aorta. You also have to say obliteration of the fourth arch artery. Then only you will say that abnormal subclavian artery is coming from the descending aorta. So both statements are important here. So this is about the development of the vascular system, guys. We talked about the major veins and the arteries. And in the third and the last part, we'll be talking about the interatrial, interventricular septum, and as well as the development of diaphragm in that part.